Welcome to Massage Therapy. I'm Moy, and today we're diving into the world of carpal tunnel syndrome relief. Get ready to learn a variety of powerful techniques to ease pain and restore function. From soothing deep tissue massage to targeted trigger point therapy, passive and active stretches. Join me as we explore how you can bring comfort and healing to those suffering from carpal tunnel syndrome. So let's get started. Let's start with an active pin and stretch technique. This method is highly effective and engages the patient right from the start. We'll start with the flexors. Choose the specific flexor muscle based on trigger point findings or the patient's symptom description. Instruct your patient to flex their wrist and fingers to form a soft fist, ensuring they do not tense their forearm. Stand over the forearm and apply firm pressure with both thumbs. Then, have your patient extend their wrist and fingers back until they've reached full mobility. A common question I get is, how do I know how many strokes to do? The answer is simple. Palpate during the warming phase and work the muscle until you feel some firmness reduce. Remember, even 1% improvement is progress. Adjust the pressure as needed since intensity can vary across different parts of the forearm. Some days, I prefer the seated variation for this technique, depending on the day. Create a C shape with both hands, emphasizing pressure with your index and middle fingers. Guide your patient through flexing and extending, exactly like before. You can apply the same technique to the often overworked extensor muscles. This is especially beneficial for patients who spend a lot of time typing. The extensor digitorum tends to be particularly stubborn and sensitive. For the extensors, the principles are the same, but in reverse. Start with the wrist and fingers in extension, then guide them into flexion. Use the same careful palpation and pressure modulation to ensure effectiveness and patient comfort. By following these steps, you'll be able to effectively address both flexor and extensor muscles, providing relief for many common forearm issues, like carpal tunnel. Remember, communication is key. Regularly check in with your patient about their comfort level and symptom changes. This will help you tailor the technique to their specific needs and ensure the best possible outcome. Continuing with the theme of active strokes, here's another incredibly effective and easy technique. Interlace your fingers to create a clamp with your palms. Clamp down on the forearm, pinning down both the flexors and extensors. Instruct your patient to explore some range of motion, including wiggling their fingers. Hold for at least 10 seconds. Then release the clamp and work your way down the forearm. This technique is broad and more general. To add a layer of intensity, create a C shape with both hands, pinning the extensors with your thumb and the flexors with your index and middle fingers. Apply the same principles as before. Now, let's add some dynamics to the mix. Starting with proximal to distal, clamp down the forearm with one hand while layering the other hand over it, stacking your thumbs and index and middle fingers. We are going to strip down the length of the forearm, so instruct your patient to wiggle their fingers throughout the entire duration of the stroke. Move steady and be mindful of any trigger points. Wait a minute, have we even discussed what carpal tunnel syndrome is? Carpal tunnel syndrome occurs when the median nerve is compressed as it passes through the carpal tunnel in the wrist. This compression leads to symptoms such as tingling, numbness, and pain in the thumb, index, and middle fingers. Risk factors include repetitive hand movements, wrist anatomy, and health conditions like diabetes and rheumatoid arthritis. Early treatment typically involves resting the hand, massage, using wrist splints, and avoiding activities that worsen symptoms, while severe cases may require injections or even surgery. Massage therapy can be an effective way to manage carpal tunnel syndrome. It helps reduce inflammation, relieving pressure on the median nerve, and improving circulation in the affected area. Techniques such as myofascial release and deep tissue massage can loosen tight muscles and fascia around the wrist and forearm, alleviating symptoms. Moving on to some deep stripping. I find this variation to be less common. Since all therapists know what stripping is, I won't get into the basics. Start by interlacing your fingers with your patient's overhand. Create some extension to elongate the forearm flexors. Bend the tip of your thumb slightly for more depth and strip down the arm from distal to proximal. For a second grip variation, place your fingers perpendicular to your patient's. This will allow you to apply pressure from a different angle. It's just as effective. Next, we'll move on to a static stretch. Start by interlocking your hands with your patient using your left hand. Use your right hand to grip the thumb overhand like holding a handlebar. Gently drive the fingers and wrist back into extension. Hold the stretch for a minimum of 10 to 15 seconds. In between stretches, bring the wrist into flexion briefly as a refreshing pause. Remember, communication is key throughout the session. Check in with your patient about their comfort level and adjust the stretch as needed. Now, I feel like I'm far enough into the video that I could ask, would you consider subscribing? But only do so if you feel like I've earned your subscription. If not, no biggie. I'll try again in the next video. But do me a favor, give that like button a little tip-open for me. Enough about that, moving on. This next technique is probably my favorite. We've talked about active strokes, so now it's time to address some passive ones. This technique is best for targeting the origins of the flexors and extensors. Start by creating a C shape with your left hand, getting a good grip on the patient's hand. Ensure your thumb is at the center of their palm for maximum control. Get comfortable pronating and supinating the arm with slight flexion and extension of the elbow. To begin, pronate and flex the arm. Apply pressure using your right thumb in the origins of the flexors. Then extend and supinate the arm simultaneously. Run through the range of motion without pressure first, so your patient knows what to expect. Remember, this is a passive stroke, so take the time to explain to your patient that they do not contribute to this movement. For the origins of the extensors, start with your right hand gripping the patient's hand at the crease of the wrist, with your thumb on their knuckles for maximum control. Supinate and flex the elbow, opposite to the previous movement. Create a C shape with your left hand, applying pressure with your thumb near the origin of the extensors, while your index and middle fingers apply pressure to the medial side of the brachioradialis. Finally, pronate and extend the arm. Be sure to release the pressure on the return stroke. Now let's transition into trigger point finger wiggles. This technique will further help and release any remaining tension and enhance the benefits of the previous strokes. Start by carefully palpating the extensors. Once you find a stubborn trigger point or tender spot indicated by your patient, apply pressure with both thumbs and instruct your patient to wiggle their fingers. A little zingle-zangle can go a long way in releasing that tension. For the flexors, I typically include this technique in my prone work. I managed to forget to film it this time, but I did capture the wiggler technique on the hand. Now, as we wrap up, I want to thank you for joining me in today's session. If you found this video helpful, please consider subscribing and giving the video a thumbs up. Your support means a lot and helps me create more content for you. Sending much peace and love your way. Until next time, peace out.